My name is Palak Verma, and I'm a student from Denmark High School. Today, I'll be presenting my independent project, which is a multimodal framework for accurate and non-invasive celiac disease diagnosis. So, this project basically utilizes artificial intelligence to improve how we detect celiac disease in modern day by replacing invasive methods with a smarter and more data-driven tool. Now, before we dive into what my project is about, I want to also just give a self introduction about just who I am as a person. Well, I'm a rising senior from Cumming, Georgia, and I go to Denmark High School. Some of my hobbies and extracurriculars that I do is that I'm a research intern at Emory University. I'm also the co-president for my local HOSA chapter and for Beta chapter at my school. I am the vice president. I like to also shadow and intern at local clinics, especially in cardiology, and I love to dance, especially in Kathak, which is a traditional Indian dance. And for my future, I want to pursue in either neonatal surgery or cardiothoracic surgery. Now, it's important to understand what celiac disease is and how it's a widespread and often misunderstood disease. In many rural and low resource areas, diagnosis is delayed due to a lack of proper tools, and our project aimed to close this gap by using accessible AI-driven methods. Now, with that, one of the biggest problem comes is that celiac disease affects over 80 million people, but 83% of those cases are undiagnosed. And with that, symptoms are quite common, such as fatigue and nutrient loss, so they're mistaken for more common disorders, delaying the proper treatment required. Now, you might wonder what the disease itself is. Well, it's an autoimmune condition, which means that when gluten is consumed, our immune system attacks our smaller intestine, particularly the villi, which is responsible for absorbing nutrients. And now this leads to long-term complications. And now, with that, there's various symptoms that can occur, such as a damaged villi can cause fatigue, anemia, bloating, stomach growth, and also other neurological issues as well, making the process and the disease itself quite complicated. And many of the symptoms are quite common, making it harder for it to be diagnosed. There's also a huge global health gap as well. Delayed diagnosis causes preventable harm and strained healthcare systems. For rural clinics without access to endoscopies and advanced testings, the need for an easy and scalable solution is urgent. And these are just some of the limitations with the current diagnostic methods. Furthermore, blood tests can give false negatives, genetic tests can show risks but not present. So, people with celiac disease and people that don't have it, and if they have the gene, it doesn't necessarily declare if they have the disease. And now, with that, again, the golden standard tests, such as endoscopies and biopsies, are quite invasive and expensive that can cause other long-term complications to a patient. Now, therefore, there needs to be a better way to diagnose in our system, one that can integrate different inputs, mimic clinical reasoning, and deliver fast, accurate, and non-invasive diagnosis. And that was the purpose for our multimodal framework. Now, we wanted to incorporate machine learning to combine symptom data, lab results, genetic results, and body metrics to create a more efficient model. Now, this allows detection for subtle patterns that traditional methods might also miss, and that resulted in CeliScan, which is our diagnostic platform. Our engineering goals were first to integrate multimodal data, second to train models to minimize false negatives, third to build a lightweight tool for low-tech clinics, and fourth to design a user-friendly platform that can support anyone using it. Our methodology had a structured pipeline with stages for data cleaning, feature selection, and model training to help it be accurately tested for all patient profiles and in real clinical settings. First, for data collection, we used our patient data from Wageningen University, and then after cleaning and coding it, we trained 80% of it and took 20% of it to test it from the mutual info and info gain key features that we took out from. And then after that, we tested 4 models and through running cross validations and testing their AUC scores, we saw which one is the most efficient for our purpose. Now, for our multimodal design, our framework considers different input types, symptoms, serology, and genetic markers, for instance, to stimulate how doctors think, meaning different factors are considered. And this approach increases diagnostic precision and reduces over-reliance on a singular test. Now, with that, we have many key inputs that we had in our framework. For instance, we included the TTIG-IgA blood test results, the HLA alleles, which are responsible for celiac disease, BMI, stool analysis results, and symptom clusters. We use these to train our support vector machine model, which proved to be the most reliable because it avoided the most false negatives. Now, for our model output, this model featured a binary input, meaning it would either diagnose you as not having celiac disease or you have it. And now it also shows features that matter the most, such as the CVM gave the best recall that ensured that there's no real case that was also missing while we were testing. Now, for our product integration, we wrapped the model into a working product, which means that it was fast, easy, and the most suited for real world clinics, especially in low resource areas, and especially those that also lack those invasive testing tools. Now, our product itself actually gave excellent results. For instance, our CVM model reached 97.51% accuracy with 100% precision and 94% AUC score with zero false negatives. And the ROC curve and box plot for the cross-validation accuracy distribution also showed results that were strong and consistent across all tests. Therefore, we wanted to convert our framework into an actual app. We turned it into CeliScan. Users can enter their inputs and the model will return diagnosis and an explanation for what to do next. We also have a custom RAG agent and works even in low resource settings that can provide guidance to patients, clinics, physicians, anyone that is new to our app. Now, finally, to conclude, our goal was to build a scalable, accurate, and accessible diagnostic tool. Through our multimodal framework, we helped prevent misdiagnosis and reduce the need for invasive procedures. This brings us closer to health equity and shows the power of AI in global health, especially as we all come together to incorporate it in the future for a greater purpose. These are the key references I used in my presentation and research, and I would like to thank my teammate Arpithari for truly supporting and collaborating so well on this idea and bringing it to life. I would also like to thank Georgia Science and Engineering Fair for providing us the opportunity to present our work and have great networking experience. If you would like to contact me, my email is palak.verma8579@gmail.com for any questions, or just feel free to reach out. Thank you so much for listening, and I hope you had a great time. Thank you again.